Thank you for joining me today. So today I wanted to talk a little about the day of my surgery. So I've talked to my doctors, I got the insurance to approve it, jumped through all of those hoops, and there's many hoops to get through. And now we're here on day of surgery. So previously, before you get there, I had my surgery on a Monday. On Friday, I had to go in and I had to have my blood work done. I had to have a COVID test. I had to have a MRSA test, and then they gave me my band, and then they also gave me my blood bank band, which they're very specific to not take off. So I did all the pre-op stuff on that Friday, and then on Monday it was day of surgery. So I was Dr. Hannah's, I think, third case of the day. So I had to be there if you've had any procedure, you know you have to be there hours before you actually go into surgery. So I had to be there at 6 a.m. Now the COVID was still going on, and I found out when I got there you could have one person, but I decided not to have my husband come with me. He had to go to work. They were not being really flexible with his days off to take care of me. They needed him, and I'd rather have him on the days I was home. So 6 o'clock, my husband dropped me off, and I walked myself into the surgery center. I did have my surgery at Sunrise Hospital. I had it where I work. It was so I knew where everything was, so that was okay. So I walked there, checked myself in, and I waited about an hour to be seen. So when they called me back, of course. Now, they don't want you, it all depends on where you're having your surgery. Now, Aetna, my insurance, wanted me to stay one night in the hospital. So I had to, so don't bring anything you wouldn't want to bring into a hospital, like your wallet or anything expensive, of course. I brought with me my own blanket. I brought stuff to keep me entertained, my charger, little things like that, just so I felt a little bit more comfortable, and I had it in my bag. So they brought me back. At this point, I wasn't nervous. I was anxious to get it done. Now, I was very anxious about them putting IVs in me. I'm a pretty hard stick, and the bigger I got, the harder it was for them to find veins. So when when I was back there, I told my poor nurse, you know, I was so scared, and she was so awesome. I wish I remembered her name. You have to take a pregnancy test if you're a woman. They have to make sure you're not pregnant. So I, of course, did that. So I kept seeing Dr. Hannah and God, I can't remember his name, his associate, who I actually saw the whole time. I didn't even meet Dr. Hannah until the day of my surgery. I kept seeing them, you know, popping in and out, and then finally they came to talk to me. It's my turn. They, you know, kind of walked everything through. I also had the same anesthesiologist that I had for my upper GI. So that was, you know, quick high. You know, I did all my research. I'm ready to go. I'm excited. Let's do this. So bless my nurse, she found a very good vein, and then I found myself, she stuck it in, she was so good, and then I kept myself like this the whole time to make sure they had a good one, that it wouldn't pop out and they wouldn't have to re-stick me. It's ridiculous, but that's how it was. That's the only thing I was concerned about, was don't let this come out, please don't have to do it again. Yes?
What the hell?
I'm recording, what do you want?
Why is your room like this?
Because it's on, like, what do you want? Go away.
I was gonna go use the bathroom.
Use your own bathroom.
Arya's in the bathroom.
You're not going to the bathroom.
Why not?
Go.
But I need to poop.
Go poop in your bathroom.
But Arya's in the bathroom.
Get out of my room! I want 10 minutes to myself.
What you recording though?
I'm recording my story. Now go away.
Noodle ate yesterday.
Oh, she did?
Yeah, she did.
Good. Goodbye. So I was just mainly concerned about this IV not coming out. Not that they were gonna get me up. I didn't care about that. So it's my turn. We're rolling back. So it's even for me, it was a little scary rolling in. You see all this, you know, the OR rooms, and then they bring you in, and then, you know, they wiggle yourself on and just sitting there, and I'm waiting, and I was like, come on, put me under. I want this to be done. I'm ready. I'm excited. Let's do this. That's kind of where I was at. And then finally, so my anesthesiologist comes in and she explains it's a little different than, you know, my upper GI. And then, you know, they put my head back, and it was very uncomfortable. She did warn me, so it wasn't like I wasn't warned, but she wasn't lying. That was not nice. I did not like that. I was just like, oh my God, this is how I die, being dramatic in my mind. And then I, of course, went to sleep. So I wake up. I'm not in any, like, it's so hard. It hurt, but it was pressure. So much pressure. Because they balloon your stomach up to give them more room. I had read my research, and they say they want you up, it helps move. I was the worst patient. I felt so bad for my post-op nurse. I was trying to sit up. She was giving me pain meds because I was crying. I was like, oh, it hurts. Oh, and it didn't help because I wanted to just move. I wanted to get up. So finally, after she gave me the max meds she could at the time, I sat up, and I'm begging her, please let me sit up. I promise I won't fall. There won't be any more paperwork. I'm trying to joke with her. I'm trying to just let me, please. So once I sit up in the bed, not listening to her, she finally lets me sit up at the side of the bed, and she sees that I'm stable, and she's with me for a little bit. Then I finally convince her, oh, let me go to the bathroom. I'm begging, plead, coerce, come on, we can do this. I have to tell you, immediately felt just so much better. The minute I start walking, I start moving the air. It was just like day and night. It felt so good just to move and get it. I went to the restroom. If I was, you know, I want to get up, I want to get out. So on my way back from the bathroom, I saw my doctor. He gave me one of these. I was like, yeah, good job for me. I just wanted to walk. So it did hurt, but the walking immensely helps, and that's the best part, is that it's supposed to help you. That's the biggest thing I could, you know, safely, of course. Don't get up if you don't feel safe. I felt stable. I felt fine. I know that walking is one of the biggest things that could help. And then they were like, oh, you can go in the wheelchair if you want, up, and they stuck me in the wheelchair, and up I went. And I called my husband as soon as I got my phone back from the security, because they keep everything safe. Called my mom, and then it was just me recuperating. Now, that first night, my nurses were, it's been an hour. Are you walking? Don't come in. Are you walking? Are you walking? You're walking, right? It was very much, there's really not a lot of rest. I didn't want to drink. I didn't want to eat. I didn't want anything. My dinner tray, well, I didn't get dinner. You can't eat right after. You can drink, I think, for breakfast, and I wasn't interested. I didn't want anything. But that first night, my doctor was, you know, they're like, hey, get up. You know, get up, walk. So every hour, now during the night, I was trying to sleep, but you know, it's uncomfortable. You feel very weird. And when my night shift nurse came in, and she was a little more strict. She was like, you haven't walked. Have you been walking? Go walk. And then she'd see me. I would do a lap around. I would start leaving. I'd get up, and I'd start doing laps around the nurse's station just to get up, get moving. It does make you feel better. I wasn't in a lot of pain. I just stopped taking the heavy duty stuff that night. They sent me home with some pain meds. It just made me nauseous. I didn't want to eat a thing. So if you're worried about the pain, of course, this is me personally. I did have, you know, you have the marks. I'll show you what they look like. And the one that hurt the most was the one right above my belly button. That's the big one. And of course the one right here, because it's kind of where you move, and I'm right-handed. So, but it's nothing to be scared of, for me at least. It wasn't that bad, and I'm a big baby when it comes to pain. I don't like it. It is honestly, it was harder emotionally, but we can always talk about that later. So that was just the rundown. Nothing spectacular happened, nothing too scary. My fear of IVs is what really got me going. I did not want to go IV, but you gotta do it. Yeah, I'm not afraid of surgery. I do want to have skin surgery. I was trying to have my boobs be fine, but they're kind of, you know, so I might have to get some fakies, which is sad, but it's okay. It's okay. We'll just go with it. I want tummy tuck. I want to look like a Barbie, but I want to nip and tuck and do all that fun stuff. So, but you know, that'll be for 2022. For now, I'm at 195 today, 5 pounds to 100 pounds. So I'm so excited that I'm so close to losing a whole 100 pounds. I can't wait to get to that. I can't wait to hit to my goal. I just got to keep, it's coming very slowly now, but you know, I just got to keep looking forward. So if you have any questions or, you know, any tips, just, you know, leave them in the comment down below. Thanks.